Greetings and welcome, ladies and gentlemen, to the Caring for the Caregiver program from UT Health San Antonio School of Nursing. My name is Debbie James, and I have the pleasure of talking to you today about medication management. So when we do such, what are we going to talk about? Well, let's look at how to read those labels. You know how sometimes they can be really awkward and really busy. So let's look at the labels and make sure that we are safe. You're going to hear me mention several times safety, safety, safety. Well, we know that you're caring for your loved one and hopefully you're caring for yourself. So let's all be safe. And also effective caring for this medication that they're on and their management of. There we go. Let's try that. So let's look at the labels and how we can read them. The one you see here, it looks busy. Yes, it does. But first say, take one daily by mouth. That's what it says. It says to just take it once, no, twice a day. So you see how big that is there. Take one tablet by mouth twice a day. Also, there's other things on there like the name of the medication. Now, some of these can be very small, some of them can be large, etc. But the name of the medication is there, and how many are in the container, also the dosage, and so on. So you've got all that information, small but there. And then below, other things about how many times they can be refilled, doctor, other kinds of things about expiration. When you call the pharmacy, they might say, nope, they're out, need to call the doctor's office, etc. So all that, believe it or not, is contained in that little part right there. And then you have the yellow portion on, talking about things to be cautious of and so on, avoiding certain things like having them in the sunlight, taking care of those bottles themselves. So looking at the labels is difficult, but must happen. Also on this one, written a little bit bigger, if you will, the medication metformin, 500 milligrams, that's what the tablet is. And the person is supposed to take one tablet orally, which is by mouth, twice a day, 2 times a day, by mouth, one tablet. That's what that says to us, but boy, does it really look busy with all that's on there. Also, you see something very tiny there that says glucophage. That is another name for that type medication. It's the generic name. So sometimes physicians may put in the order as a brand or the generic, it doesn't matter. The point is metformin is a medication you're getting, and glucophage may be another name people are using. So when we're talking about safety, we want to make sure that language is important. Now look at this. Lots and lots and lots of messages. Yes, believe it or not, ladies and gentlemen, these are all on those bottles that you're giving to your loved one and probably yourself. So yes, you're supposed to take it with water. No, you're not supposed to have it with food. What? If you have it with food, what to do? So you see those informational pieces are important because it could be something like the medication mixed with food is not a good idea. Or let's say that it's something having to do with other kind of medications, chemotherapy, etc. Bottom line is, look at that label. Do I take it with food? Maybe I take it a certain time of day. My loved one needs it in the nose, under the tongue, etc. So bottom line, lots of information from lots and lots of little other labels. And we're trying to be safe. Remember I said I was going to say that again and again. So safety considerations is where we are. So why is the person even on medications? If we know that, then we can look at some of the concerns. So for example, if your mom is taking blood thinners, good. Maybe she was trying to have the prevention of clots, and so that's good that she's on that medication. But you know what? That little thing in the kitchen she keeps tripping over, oh my gosh, what if she falls? That's not good. So your concern and the safety issue here is I know that my mom's on this medication and it's supposed to do the right thing, and it does, but boy, if she falls, we might be in trouble here. Same thing with water pills. People will call them that. They might say Lasix, or they might say my pill for water, or my water pill. Well, if you know that dad gets that water pill or a laxative or whatever, when should we give it? So the water pill right before church might not be a good idea. What about a laxative? If it works, where might he be, etc. So look at these medications that I have listed for you. There are reasons that they are being given, if you will. Diabetic. How is that diabetic medication given? What about antibiotics? Believe it or not, ladies and gentlemen, I've had patients who have told me, I have a cold and I got this from my doctor, the antibiotic. And my husband got it too, so I just gave him half the medication. That's not how we do it. If the doctor prescribes a medication, an antibiotic, for that cold, whatever it is that you have, that infection, that's the person who takes the medication all 10 days, and that's done. If another person is ill, they see a physician and get some kind of prescription or whatever is the appropriate treatment for that individual. So there you go. Not sharing medications is what I'm saying, being safe about that. Why are they on it? There we go. So effective medication management is what this whole story is about. So how can we do that? Well, let's look at what medications are they on. I keep going back to that, and it's really important. How about a list? A list of those medications would be super good. That'll also help you take care of yourself. How? Well, if your brother's going to come take care of mom while you're gone for a whole day, maybe he's not really sure of the medication regimen. So let's look at the list of medications. How are they given? Reading those labels and so on will help other people help you take care of mom or dad and so on. Whenever you go to the physician's office or talk to the nurse practitioner, wow, is it helpful to give this list of medications of the plan to that individual to help out? Then also, while you're talking about the list of that, how about the medical history? Those past surgeries, past injuries, past anything that's gone on, the new person taking care of your loved one will really help them to have this information about their history and the things we're doing for it now. Also providers, agencies, institutions, things that are going on with your brother's care right now. What is it that we can do to help out? Perhaps having different agencies, maybe a specialty organization, maybe Alzheimer's is really doing something with mom, etc. So the agencies, the institutions, as I said, providers that are taking care of your loved one, wow, would that be great to have them on a list? Now, one of the things I will tell you that if you take, let's just say, your mom to a new physician and it's a gerontologist. Now, that's a person who takes care of people that are older. One of the first things I've heard gerontologists say is, look at all these meds. So many. Too many medications. And really, by and large, people in this country really are taking more and more and more. So bottom line, when you have the physician seeing mom for the first time, he might say, let's get rid of half these drugs. And so the picture there with the lady, all of those medications, believe it or not, that's how it really seems. So in looking at the medications, what should we do to take care of the right amount that are being taken? If you don't know, ask. Ask the physician, ask the nurse practitioner, ask the pharmacist. That might be the right person. Just remember, there's no silly question. There's no stupid question. If you don't know the answer, you need to ask. So I'm going to tell you that one more time. That's all about safety. Ask, do the best you can with every bit of the medication regimen. Ask, ask, ask. If you don't know that your loved one knows who's taking care of themselves, how about your own self? How about the number of medications you take? So I'm wrapping this all up by telling you, whatever it is regarding medications, let's be careful. Read those labels appropriately. Make sure that we're keeping our list, keeping everything in order in the history, and also take care of yourself. Have a great day. Thank you. Be safe, and God bless. Have a nice one. Thank you.